Right now, what is abundantly clear to us is that there is no global solidarity. There is no care from north to south. Countries in the global north are not walking the talk of solidarity, and we are dying. From the outset, we've been saying what will happen undoubtedly is that the rest of the world will vaccinate and Africa will become known as the continent of COVID. And that is something we cannot stand by and watch. The African Alliance has been working on COVID since the very start. From our first meeting with the doctors in Wuhan, understanding the impact of COVID in their communities, to making sure that every single COVID vaccine trial that happens in South Africa initially, that communities around those research sites are taken along for that journey. Of course, now we've evolved from making sure no community is left behind in vaccine research engagement to the issue of equity and the grotesque situation we see currently in terms of vaccine inequity. And those very communities who put their bodies on the line to make sure vaccines are accessible through supporting vaccine research are now looking on as their colleagues in the global north are taking vaccine selfies. And yet we have yet to reach 10% vaccination on this continent. It's absolute tragic.
This is our non-breather mask.
The main thing that everybody should know about vaccine distribution in the global south is that it's been really slow. Not everybody is receiving a quality service, and that we are risking a generation if we don't do this fast. Because as the world is beginning again to open and to move around, we see that all these variants are spreading really quickly, and previous issues, previous structural inequalities are multiplying. What we noticed in the beginning was that the way in which the Colombian government was designing these strategies was having in mind mainly the cities. And most of the time, not having into consideration Afro-descendants, indigenous, and the most vulnerable population of the country. And we noticed that because the basic requirements to survive the pandemic, washing your hands, having masks, and accessing antibacterials, they were not easy to be found in the Colombian region, in the Colombian Pacific region. So you will see several communities with shortage of water, of not having access to water, of the minimum conditions to comply with the quarantine requirements. At the same time, there was not much access to masks. That was basic to survive.
In South Africa, the communities that are most affected by slow pace of vaccination would be rural communities. And that's largely because of access, because many people have to travel long distances to access health facilities. In South Africa, the goals of the foundation are really aimed at a number of things. The one is around efforts to fix the intellectual property laws in South Africa. That's part of the biggest impediment on access to medicines. And at the same time, they are also supporting the South African government and the Indian government in their call to the WTO for the TRIPS waiver, because that's one of the ways that will make access to the vaccines easier. They've also been doing a lot of the communication in terms of educating communities, working with the media around the appropriate messaging around COVID-19.
I think global north countries can do one very simple thing. Tell us the truth, fulfill your promises. You've not fulfilled your promises. We want the countries who are hoarding to stop hoarding and share these supplies. But we also don't want to be treated as a garbage bin, where these vaccines are sent to Africa with 2-3 weeks to expiry. So what ordinary people can do, they can call their senator, they can call their public representative, they can call their political leadership and say, what are you doing to ensure that the vaccine that my tax dollar paid for gets to those who need it most? Don't underestimate the power of social media. Don't underestimate the power of tweeting, of a Facebook post. Say something. You might feel it's overwhelming. You might not know what to do. It might seem a huge equation, these multi-billionaire pharmaceutical companies, these out-of-touch politicians. But every time you speak out in support of African lives, you do the right thing, and we count on you to do that.